think about all the illnesses people have, and they say, oh, it's all in your head. And it actually turns out that that's true.
Get ready for your unofficial dental hygiene podcast. These are the tales of two hygienists, one East Coast RDH and one West Coast hygienist. Listen as they tackle the profession of dental hygiene with humor and enthusiasm. Now, please join Michelle Strange and Andrew Johnston as they tell you a tale of two hygienists. So this is a fun bonus episode and kind of a teaser to get you excited for content to come. So you have heard these two on the podcast before, and they were talking about Airway. And what was so cool about them was that it was a collaboration, an interprofessional collaboration between a nurse and a hygienist. Like, doesn't that make all the sense in the world? But tonight, or in this moment, this little teaser, it's gonna be brought to you by Cyndee Johnson and Julia Worrall. Am I saying that right? Worrall?
That's excellent. Just roll your tongue around there.
I could probably talk about my tongue tie later. Welcome.
Thank you so much for having us.
Thank you. Well, I would love to, first of all, I want to say a couple of things about Andrew and Michelle. We have been on the podcast a time or two, and being part of the #1 dental podcast is not only really exciting, but one of the reasons that Julie and I are so honored to be here today and talk about this exciting upcoming event is that one of the things about your podcast that we adore is it is purely educational. There's no cluttering or clogging of information, and it allows the listeners to really get some great education. So thank you both for that. We talk about that, Julia and I, often. We so appreciate it. Julia, do you want to tell them a little bit about what we're planning?
Yes, absolutely. I think one of the highlights of October is the fact that it's Dental Hygienist Month. And as a nurse, I'm so grateful for what you do, because we see time and again the comorbidities of people that have airway issues. And you guys as hygienists are staring into those mouths from the time they're really little all the way up through the ages and stages of a lifespan. And so who better to really spearhead the movement of airway but hygiene? So that's what I'm excited about, is to share in this path with you, to be doing some education on pediatric airway, adult airway, and even talking about craniofacial structures, how that affects airway, and all the comorbid stuff that we see that goes along with it.
Well, we hear a lot about airway. It seems very hyped right now, but it's a lot of talk, and we're really excited to learn something about what all of it means and what we can do as hygienists.
What's really exciting for us is Julia and I working together and really learning about both of our professions and being able to deliver to our hygiene colleagues, letting them know that, yes, this is something that's so important, but more importantly, how can we give them the information, and then with the information, the tools that will allow them to implement this into their practices, into their own dental hygiene practice. Because anyone who's sitting beside the dental chair doing dental hygiene understands the value of a second. And with all of this information coming at us full force on a regular basis, there's so many things that we want to be able to do, but we just don't really know how to make it happen. So one of the things that we're hoping to help everyone with is to understand a way to fit it in to what it is we do every day and help a lot of people along the way.
And I think that's an excellent point, Cyndee, because I think the apprehension a lot of people feel is that they just can't squeeze one more thing into what they're doing on a daily basis. And I hear that time and time again, the pressure to cover so many areas. I think, though, when we share the information, the four of us, I think people will really feel impassioned that it's like removing a veil. you think it's going to be a challenge, but really it's just opening your eyes to what you are already seeing every day in those chairs. It's just now defining it in terms of airway, sleep breathing disorders, tongue ties, and understanding the connection between the two, that it goes beyond just
It's about restorative dentistry. Everything. It's about overall health, and it's about we all want to give our patients the treatments they need and deserve. And when we have these factors that are impeding long-term health and wellness, it also impedes the success of the treatment that we do provide. So it's so tied together with everything that we do in dentistry. So important.
I heard somebody the other day say that in dentistry, they're always looking for harder and harder products so that the restorative dentistry that they do will last. And what they were saying that is if we address the underlying airway issues, we wouldn't have to worry about the damage and the impact to the restorative dentistry. So I think that that's one aspect like you're mentioning there.
Michelle and Andrew, I just want to, on behalf of both Julia and I, and really on behalf of our profession, thank you for what you do. Thank you for the impact that you've had for all of us that listen to you, all of the great information that you share. And we're so, so pleased to be here and to be offering what's coming down the pipe. So thank you for the invitation.
Oh, we're so happy to do it. And thank you also. I mean, this is a great opportunity for Michelle and I to really partner with you guys on not just a few podcasts, but this is going to be the launch of something so much bigger, as you were alluding to earlier. We're going to put out some podcasts, but listeners, guess what? You can't learn everything on a podcast. And so we're going to try and do some video content for you as well. And another really exciting thing is there's going to be conferences coming up. Things that are going to be, we're going to only be able to scratch the surface on a little podcast. And I think that's what really excites Michelle and I, is partnering with two amazing professionals like yourselves and being able to get this information out to everybody.
Yeah, totally agree.
So that's exciting.
Yeah, very exciting. I'm humbled and I'm blushing, Andrew. Thank you for that. That was so nice. We're looking forward to it, you too. Thank you, thank you, thank you.
You're welcome. And I think our audience is going to be really excited. I think this was a great teaser for what is to come. Even if you think the airway is not something that is in your scope of practice or important to you, it's all connected. Stay tuned because there's a lot of great content about to come to you.